Welcome to Let's Talk Wellness. It's time to have new conversations about mental health. Join Mara James as she guides us along this journey. And now, let's talk wellness.
Welcome to Let's Talk Wellness. I'm your host, Mara James, and I want to say thank you for joining us today. These conversations are all about taking a deeper dive into understanding how we can help support children and their families to have better mental health and emotional wellness. Let's Talk Wellness is brought to you by the Extraordinary Lives Foundation, a nonprofit organization whose mission is to improve children's mental health and emotional wellness. You can find out more information about ELF and more episodes at elfempowers.org/podcasts. And you can find this information in the show link below. Now, let's talk wellness with today's guest, Adrienne Shilton. Adrienne is the Vice President of Public Policy and Strategy at the California Alliance of Child and Family Services, known as the CA Alliance for short. Welcome, Adrienne.
Thank you so much. It's great to be here.
Oh, that was a mouthful. I hope I said it correctly.
All correct.
Beautiful. So tell us, what is the California Alliance?
The California Alliance of Child and Family Services represents 165 nonprofit, community-based organizations across California. And the common element that brings all of our member organizations together under the Alliance is that they are serving and supporting children and youth and families in public systems. And so our nonprofit members provide quite a range of services, anywhere from outpatient community behavioral health services, intensive home-based supports, school-based or school-linked services, and also foster care programming, including outpatient and residential services. We also have quite a few of our nonprofit members who do a range of preventative services as well.
Beautiful. And what is the age range of the children that you focus on, or that the Alliance focuses on?
It's 0 to 26 when we talk about, children and youth, but our organizations also work with families. So it doesn't, it doesn't necessarily stop at 26. Like the work that our members do really continues even beyond that, and includes work with families and with adults as well.
And these are nonprofits all throughout California.
Exactly. We have actually a member organization in every single county in California, so all of the 58 counties. Wow. And these are public systems. So this is, these are safety net services. These are kids and families who are enrolled in our Medi-Cal program. These are, foster youth and families and caregivers as well.
Right. And when you say safety net program, what is that? What is that term? People probably aren't familiar with that.
Yeah, I mean, basically what I mean by that is, it's public human services systems. So, these are often, families who are in poverty. These are families that and children who may have, fallen through the cracks in other, parts of our system. And so our member organizations, in partnership, right, with others, with the counties as well, are there, as the safety net, as sort of the last kind of the line of defense to, help families get back on their feet and thrive.
I love that. And when you say 0, are you working with pregnant or?
Yes.
Say you. I'm talking about the collective you. You're working with pregnant women?
Absolutely. Absolutely. In fact, there are some organizations in our membership that specifically do work with pregnant and parenting foster youth. And this is kind of a special, specialized program that we have in California. So that's, some of our members do that work as well.
That is beautiful. I always say my heart goes out to foster kids because I had 0 for 2 parents. They're both mentally ill or mentally challenged. And, but at least I had some stability, whereas I feel like a lot of the foster kids don't. And whether it's a foster child or even adoptive child, like there's so many mental health challenges. I feel like they have from this moment they're born, they have like cellular trauma that they're not even consciously aware of. So it's great that you go that upstream approach, which I love. That's beautiful.
Yeah, thank you.
And then you said you go up to 26, so which is 25 and 363 days, are you right?
Right.
Now, a lot of people might not know because children listen, we're all children, right? Even at 50 something years old. But I love, that when a child is on their parents' insurance up to 26 years old, they say the brain doesn't fully develop to 26 years old, right? Or 25. So
Right.
are you keeping that age range all in line with those two things?
Absolutely. And you mentioned insurance. So, the majority of the youth and families that our member organizations are working with are in our Medi-Cal insurance program. And it's quite a number of children who are in our Medi-Cal program. In California, it's about half. It's about 50%, 1 in 2 children in California are enrolled in our Medi-Cal program. So we have an incredibly high poverty state. We have a state that has, the extremes, right, on sort of both ends. To the some of the richest wealth, and also we have, again, high poverty. And so that's those are the families that we work with.
1 in 2 children in California. I haven't heard of that.
Yes.
Wow, that is unbelievable. So Adrienne, it sounds like each county really works hand in hand with these different nonprofit providers.
Absolutely, absolutely. I mean, this is the partnership that I wanted to highlight today, is that our member organizations, couldn't do this work without the partnership of the county behavioral health departments. So that partnership is essential, and it's also something unique about California in terms of how our service delivery system works.
So other states don't do this?
There only are a few other states that have sort of this, what is known as sort of a carve out in the specialty mental health system, which means that, we have our own our own funding, and that creates a situation where these partnerships can exist, where the counties organize the service delivery system and partner, in a targeted way with nonprofits to meet local needs.
Beautiful. This is so wonderful. And again, so this entails, the Alliance covers like prevention, early intervention, and intervention.
Absolutely. And that can look different depending on, how old, the children are. Like, from our perspective, work in schools can be a preventative service strategy, where we're getting to kids early. We're getting to where kids are and where they're spending the majority of their time. And we're doing this in partnership with schools. So many of the Alliance organizations are actually on campus, are on K-12 campuses, either doing, therapy, or other supportive services there, or linked in some way. And the beauty about a community-based organization is that the work can start on campus. The relationship building, the trust, the work can start on campus and then can continue in community, because the needs don't stop at 3 o'clock. Monday through Friday. The needs continue. They continue on the weekends. They continue when school's not in session. So, the work really with the community-based organization can, really create kind of that transition from school to other supportive work that can be done in community or in home.
That's so beautiful. How long has the Alliance been going?
We have been around since 2000, so we're celebrating our 24th year. Continue to grow our membership. So I started with the Alliance a little over 4 years ago, and we've grown our membership by about 25 organizations since then, 25 more nonprofits into the Alliance families doing this work to expand what we can do and advocate for. And we are, as the Alliance, we are the advocacy voice for these nonprofit organizations in Sacramento. So we work with our administration, with our governor, with the governor's departments, and with the legislature to break down barriers, all with the goal of like how we can create a system where every youth and child and family have access to the services that they need, where they need them, and that the intensity that they need them. So our policy, our policy platform really reflects that, and is within these different kind of areas that I was talking about: education, child welfare, foster youth, behavioral health. So our policy agenda really reflects that work that's happening on the ground with children and youth.
So amazing. Again, this upstream approach is so important. So we're definitely not going to get political, but I would like to ask about this Proposition 1. Can you, so what your organization was part of creating that, is that correct?
We were part of responding to it.
Okay.
So the Mental Health Services Act is something that, is a funding source for, many organizations in our membership. In particular,
let me stop you there. So
sorry.
no, it's okay. So MHSA. So where does that funding come from?
So that's a millionaire's tax. So I should start there.
Yeah.
Okay. Okay.
Assume some of us don't know much and you'll be teaching us. Yeah. So let's hear about the MHSA mental health service, where the funds come from and then how they're distributed.
Yes, the Mental Health Services Act is funded by a 1% tax on taxable incomes over $1 million, so-called the millionaire's tax in California. It was an initiative that was passed back in 2004. I actually worked on it. I worked on the campaign to pass, at the time it was Proposition 63, and became known as the Mental Health Services Act.
And so you said you worked on that work. Who were you working with when doing that?
I worked with the nonprofit providers that were one of the co-sponsors of the initiative.
Amazing.
And so I've seen the Mental Health Services Act, been rolling out since 2004. In fact, we're just at the 20th year.
Yeah. I was just looking, I was like, wait, we're in 2024. Amazing.
Yes. And so Proposition 1 was a proposal from our governor with legislative leadership, because it was in the form of a legislative proposal, a bill.
Okay.
And so the Alliance was a central stakeholder in the advocacy around it, because our organizations receive funding and are part of the service delivery system that is funded by the Mental Health Services Act. So our particular concerns when the proposal was first released back in March of last year was the fact that there was no longer a prevention and early intervention component. This was a central aspect of Proposition 63 back in 2004, that there would be a standalone set aside of funding specifically to focus on upstream services and kids. How can we turn the tide, right? How can we get ahead of the crisis that we have on our streets? No one can deny that we have a homelessness crisis. We all see it every single day. And the unique aspect of Mental Health Services Act was to have this standalone component to focus on young people and to focus on, issues before they become a crisis, before people become homeless. And so when the proposal was first released, there was no, that was not part of it. So that was our advocacy at the California Alliance, was to ensure that we didn't lose that vital funding source. So we were able to work collaboratively with the administration and with our California state legislature to ensure that those components were put back in. And ultimately, they are contained in what is now Proposition 1, that was on our March ballot, that as of March 18th is actually too close to call. We don't know the outcome as of March 18th.
Wow, that's amazing. And a big part of the proposition for people that aren't aware of it is putting money towards the homelessness?
There is really an increased emphasis within Proposition 1 to focus on housing and to focus on the crisis on our streets. So some of the other shifts and a rearrangement of the Mental Health Services Act includes now a specific standalone component for housing and housing supports, and increased emphasis in funding for what are called full service partnerships. Mm-hmm. And these are programs that do outreach to individuals who are in encampments, like, on the street, to try to engage them into services. So that's, housing and full service partnerships are really, again, proposed in Proposition 1 to be an increased emphasis.
And then, so of course, the question is, if the money is going there, where is it coming from?
Well, it's still, yes, I mean, it's still right. So there isn't new money. That's a very good question. There isn't new money being proposed here. It's still the millionaire's tax. So we're still talking about the same, pie, the same amount of funding, but with these, sort of additional expectations around housing, around full service partnerships. And I would add that actually something that is, a positive is an increased focus on those with substance use conditions as well. That, this, it was called the Mental Health Services Act. With Proposition 1, it's proposed to be called the Behavioral Health Services Act. Behavioral meaning inclusion of substance use disorder programming as well. So that's another emphasis. That's something that the California Alliance was very supportive of, was to sort of break down that barrier that, really didn't allow for these dollars to be specifically spent on, somebody with a substance use need.
So it's really helping their, stabilizing them with, housing, shelter, food, but then working on the mental health underlying component.
Absolutely. And which oftentimes, I mean, we look at what the data shows us is that can be, sort of, happening at the same time as a substance use need, mental health and substance use. So to be able to address both, is really important. I mean, we're talking about one person and they may have multiple needs. So this really opens up, an opportunity that didn't exist prior. So that's an amendment we absolutely supported.
That's beautiful. And did you say, when we previously spoke, that you worked with First Five California on this?
We did. Yes, there were several very important children's advocacy organizations that worked alongside of us to, propose these amendments, including First Five of California, Children Now, Children's Partnership, and the California Children's Hospital Association and the California Alliance. So we really came together and advocated together with, the same proposal, the same language, that we must have, prevention. We must have early intervention funding. And we're talking about kids. And we had some other changes too, but that was the primary, big concern and primary amendment that we all worked on together. And ultimately we're successful. And honestly, that coalition building was, I think, maybe the secret sauce.
Yes.
Was to have all of us as, children's advocacy organizations come together and advocate essentially with one voice. On this.
Yeah, and the First Five is up to 5 years old. So it's really an upstream approach or talking.
Absolutely. Absolutely.
That is amazing. We are going to take a brief break. And when we come back, we're going to talk about the crisis that's going on in California. So stay tuned.
We hope that you're enjoying today's Let's Talk Wellness podcast. And if you have a topic that you would like us to explore, we would love to hear from you. Simply email us at info@elfempowers.org. That's info@elfempowers.org. And now, back to the show.
Welcome back to Let's Talk Wellness. I'm your host, Mara James, and today we're speaking with Adrienne Shilton. Welcome back, Adrienne.
Thank you so much.
So I want to rewind for a minute. And what can you share with our guests what a community-based organization is?
Absolutely. So when I say community-based organization, I'm referring to the nonprofits in the California Alliance membership that are rooted really in the communities that they are serving. So they are recruiting workforce from the communities. They are speaking the language of the communities that they're serving. They look like the communities that they're serving. So they're truly community-based. And many of our organizations have been around for 100 years. So they are really deeply rooted in the culture of the communities where they are located.
So beautiful. And if there's a nonprofit that hasn't heard about you and they're listening or watching this, could they reach out to you? We can give contact information at the end.
I would love to talk to any nonprofit that is not currently an Alliance member and would be interested in learning more. We have an incredible network, of resources with the California Alliance. In fact, we were all just in Sacramento last week for the California Alliance's policy conference. We had 200 organizations in Sacramento that participated, and we also organized an advocacy day. So we actually organized legislative meetings in small teams of our nonprofit members to advocate on behalf of the California Alliance. We had 74 meetings. There are 120 legislators total, so we covered a lot of ground in one day.
And this was last week.
This was last Tuesday.
Amazing. Well, I was off in Mexico last week, but if not there, I would have loved to have been with you. Beautiful. Thank you for clarifying that. So when we spoke previously, you spoke about the crisis that's going on, I would say in California, but I'd probably say in the United States, maybe the world. Our U.S. Surgeon General, Dr. Vivek Murthy, said that we are now in a global mental health pandemic. So let's talk about the crisis as we're experiencing it and seeing it in California.
Yes, well, thank you for that very important question. We couldn't agree more with what our National Surgeon General has said. And our organizations see this every day with kids. The pandemic, I would say only exacerbated the issues that we had a crisis prior to 2020 with our youth. And was one of the reasons actually that the California Alliance worked before the pandemic to establish our state's first Office of Suicide Prevention in our Department of Public Health. This was a bill that we worked on with Assembly Member James Ramos because we were very concerned about what we were seeing with the data on youth suicide. It's still the second leading cause of death among adolescents. We're very concerned about what we're seeing, and the needs continue to this day. So on some recent site visits, across the state with our members, we hear similar themes, that the needs are increasing, the acuity is getting higher. So in other words, needs are increasing, and kids are getting younger in the programs. So younger kids are coming in and needs are higher. So from our perspective, this means that we need to do everything we can as a state to provide the public system, the public behavioral health system, both the counties and their nonprofit service providers, with the resources they need to care for these kids and families. Because we still have an underfunded system.
Yeah. So I'm scared to hear the answer to this question. When you say younger, how young are we talking?
I'm saying they're under 6. Sometimes the needs are presenting as young as 6 to 8 years old.
With suicidal ideation?
Yes.
Unbelievable.
We have kids as young as that age calling our new 3-digit suicide prevention lifeline 988.
Mm-hmm.
We have organizations in our membership that respond to the calls that come in, that also respond if there needs to be like a mobile response, like not just on the phone, but actually dispatched. So we have organizations in our membership that do that work as well. So this is real. This is real life. We are seeing what our Surgeon General has called, raised the alarm bells on this.
So 6 to 8 year olds are picking up the phone and dialing 988. Well, what's amazing, it's terrible, but what's amazing about it is that they even know, because I know this number is pretty new, right? It's only a year or two old.
Yes.
Wow.
This lifeline always existed, but it was not a 3-digit easy to remember number. So that's the change. And also, young people can text. You can also text for support, and also you can write in on a computer as well. Like you can chat on a computer as well if that feels more comfortable to you in the moment.
Amazing. Wow. Yeah, this youth mental health crisis is a doozy. And
yes.
And then you spoke about substance abuse of youth. Can you share about that?
Yes, I mean, so something that we're very concerned about actually is the way that schools have been responding to the substance use crisis among our young people. And that is through approaches that are more punitive in nature, right? Through suspensions and expulsions. We're very concerned about this trend and about the disproportionate impact of these punitive policies on our students of color in particular. It is overwhelmingly students of color who are being suspended and expelled because of substance use on campus. So we are trying to change that with a bill this year, Assembly Bill Yes, I'm excited to talk about it. Assembly Bill 2711.
Okay, 2711. Wow.
Also authored by Assembly Member James Ramos. I
Love
mentioned
you,
him
James.
earlier.
Love you, James. Don't know you, but
And
I love you.
he's amazing. He's from San Bernardino area, and he's actually the first Native American elected state official in California. He was elected in 2018.
Amazing.
And we've worked with him since he's been elected because he champions children's behavioral health every single year. He's our champion.
Oh my goodness, I hope to meet him one day. And to me, like, we need to be part of the solution, not the problem. And kids want to do well if they can, and we need to give
Yes.
them the tools.
Kids are calling for this policy that we have in the bill 2711. We have a youth-led co-sponsor called the California Youth Empowerment Network. They're entirely youth-led and youth-run, youth
Wow.
board, youth staff, and they held focus groups across the state to talk to kids about what are the needs. And you know what they said? Stop punishing us for our trauma.
Oh my God.
And so we are,
wow.
and that's what's happening with these punitive approaches.
Wow.
You know,
Yeah.
there is a reason why we see the behavior, right? It's manifesting in a way that looks like drug abuse, or is there obviously is that too, and we need to be supporting these kids.
Yeah, I mean, they're self-medicating. What are they medicating? Let's help with the extreme approach underlying.
There's underlying issues here.
Yeah, and this is like, I took a class, my husband and I, years ago, because our son was diagnosed with Asperger's and ADHD at the age of 6. And this is where we learned children want to do well if they can, and how to like not build that the resentment and build resilience. And oh my goodness, I mean, it was a long and exhausting road, but definitely, working with the school to help them, not make it worse.
Not make it worse, not push kids off to other systems, right? To the juvenile justice system, which is what we see. And it's our kids of color. It's our kids in Medi-Cal. It's the kids that we work with.
Beautiful.
There's actually some data too about foster youth and homeless youth being disproportionately impacted by these punitive approaches, by the so-called zero tolerance approaches that do not work.
Yeah. Oh my.
So we're trying to change that with this bill. We're very excited to move this forward.
Ooh, zero tolerance. That's like a heavy woof.
That's a heavy phrase.
Ooh,
it's not based on research.
It's not so warm and fuzzy.
Right.
And then you said there's also a crisis with foster youth.
Yes. I mean, it's similar, like there's obviously intersection with all of these issues with our youth behavioral health crisis, what's happening with foster youth, and also what's happening with our kids and substance use. But we need to do much better for our foster youth. We still have very alarming data to show that they are transitioning into homelessness. And one of the proposals on the table this year that we're actually fighting back against from the administration is a proposal to cut funding that offsets the high cost of housing specifically for foster youth. It's called the Supervised Independent Living Program, and it's a supplement that foster youth can receive to help them cover the cost of housing. It keeps them housed. And we already know that a quarter of foster youth transition to homelessness.
What's the age range that supplemental funding?
It basically is for like the transition age youth range, like the 16 to 25 range.
That's also the transitional age youth, is that TAY group. And I
was
wondering, like, I hear it's 12, is it 16, is it 24? So is officially TAY, transitional age youth, that's 16 to 25?
Yes.
Good to know. Okay. Wow. So you're saying that there's a proposal out there to cut the funding?
Yes, to actually eliminate, not just cut, but eliminate the program. So
and then increase the homelessness and then put the fund.
We're very confused about that. Like, from our administration that absolutely has prioritized addressing the crisis, the homelessness crisis. Here is a way to prevent homelessness, prevent foster youth homelessness in particular. And so we are advocating against that cut, along with many other organizations. So we're in partnership with children's advocacy groups on that one.
Wow, amazing. Thank you for that. And the fourth, you said the crisis is affordable housing. Oof. Tell us
Yes, so many,
what's the
so many,
deal.
and again, no, intersecting crises, but, there was a landmark study that was released last year by UCSF, by a researcher named Margot Kuchel, a landmark study about homelessness in California. And what they found was the number one reason why people in California are becoming homeless is because of the cost of housing. And they have recommendations in this report about how what we can do about that. Like, and it's all about like, how we can support people, paying their rent, subsidies around this issue. It's not, which is sort of sometimes the story that's told, is it's not because of mental illness or substance use, right? Where people are becoming homeless because of the high cost of housing, which then can lead, homelessness creates all kinds of trauma.
Yeah.
People, are traumatized on the streets, and, issues can be exacerbated right at that point. But
Absolutely.
mental illness is not driving our homelessness crisis. It's affordable housing.
Yeah. Wow. And though, is there a concern though, if there's a supplement that the money might be used like for drugs or something versus the housing, or?
We have a difficult budget year. We have anywhere from, depending on who has the estimates, anywhere from basically a double-digit billion, multi-billion dollar budget deficit. Our legislative analyst's office has pegged this at 78 billion. The governor administration has pegged this at about 40 billion. So there is a gap, but bottom line is double-digit, multi-billion dollar deficit. So there's many proposals, right? And there are cuts proposed across many of the areas that our government oversees. This is one of them, unfortunately, that we're fighting.
Wow. Okay, so I want to bring this to a positive note. Give us some good news.
Well, I can tell you this, that the members, and I left last week, having spent time with our organizational members. The members are incredibly inspiring and do inspiring work for young people. And we are changing lives. We don't often hear about that because we hear about the crises.
Yeah.
But there are remarkable stories across the state of youth doing better. I was in a site visit recently, and it was in a short-term residential therapeutic program, and they had this wall of photos of youth who had graduated from the program and had gone on to live their lives, including graduating from college. There were these youth sent back photos of the college graduation photos, reuniting with their families, coming back to visit. So there are also the stories of resilience and hope, and seeing this wall of photos was so powerful. And any one of our organizations could have that.
Yeah.
Right. Just like the youth who have gone on to thrive, essentially. From a very a difficult place, like starting, these are foster youth. So trauma and other, adversity to graduating from a UC.
Amazing. Unbelievable. And you know what? You save one person, you save the world. So, and there are so many amazing organizations helping so many children and families.
Yes.
Adrienne, what's the best way for someone to get in touch with you?
Well, I am available by both email and phone number, and we'll include that contact information as follow-up. We also have our website. So that's the www.cacfs.org. You can find out more about our member organizations there, but for me, we'll make sure to provide that contact information. Please reach out for resources, to get connected to a network of incredible organizations that do this work every single day with our most vulnerable children and families. We'd love to connect.
Beautiful. It has been such a pleasure speaking with you today. And I want to remind you and all of our friends out there that you are amazing.
Thank you so much for having me.
Thank you for joining us for this episode of Let's Talk Wellness. This podcast has been brought to you by the Extraordinary Lives Foundation, a 501c3 nonprofit organization. If you would like to listen to more conversations like this, We invite you to subscribe to our mailing list at www.elfempowers.org to be notified when our episodes are published. Thank you for joining us, and we look forward to bringing you our next conversation on Let's Talk Wellness.